Welcome, everyone. Yeah, I'm so glad to have you here. And my name is Ishimi Alliance, and I am going to moderate this session. I am Youth Focal Point in Rwanda for FP 2020. And I am with two young adults here who will be helping us in today's discussion. I want to introduce them right away. We have Leesah Cynthia Niwenahisemo, who is a certified psychologist with a bachelor degree in clinical psychology. She has been interning in data neuropsychiatric hospital for the past year, and she's currently doing her master's degree in psychiatry abroad. She's also a champion advocate and rights, has been working with HDI on raising awareness in youth on sexual reproduction health services and rights, as well as advocating for young people. So you will help me welcome Niwenahisemo Leesah. And on the panel as well, we have Bahire, who is a certified champion in Health Development Initiative Rwanda. He helps teens and youth to understand and know more about sexual reproductive health and rights and associated issues. He is also a public speaker, a debater, and a debate coach. And he has participated in HDI researches on adolescents' relationship countrywide as a data collector, and he was empowered by HDI as well. He enjoys advocating for fellow youth in debating about what issues the youth is facing nowadays. And those are our two speakers for today. And we only have 1 hour. So everyone who has a question, please drop it in the chat box. We shall be discussing for maybe 30 minutes, hearing from our speakers. Then after that, they'll take the floor to respond to questions that you will have dropped in the chat box. So today's topic is empowering the youth on sexual reproductive health and rights information and services during COVID-19 pandemic. So this discussion will be about youth, COVID, and empowerment. And I hope you are all excited about the discussion today. It is going to be recorded, so be sure you are on point, because you don't know, everyone might see it and you might become the next star we have. So be ready. Are we ready to do this? Are we ready, Cynthia?
Ready.
Are we ready, Christian?
Yes, ready.
Okay, so here we go. So I'm going to ask you one little question to start the whole discussion. So I would love to hear from you both. So what do you think have been the effects of COVID-19 on the lives of adolescents? And please be specific about this. You can talk globally. What do you think has been the effect of COVID-19, and what do you think has been the specific impact or effect of COVID-19 on sexual reproductive health and rights of adolescents? Over to you, Cynthia.
Okay, thank you very much.
I would start before the pandemic started. There was an issue with providing important SRH information and services in time. But then, as the pandemic stepped in, making it even hard to provide usual services for basic health, now it became even a more bigger problem to provide these services and information on sexual reproductive health and rights. Also, there is another problem. The fact that the pandemic has been, putting in the lockdown and transport isn't being worth it. Now the delivery of these services has been delayed, which usually is obviously going to even spike the teenage pregnancy more. And again, I would like to talk about how this pandemic has strained even the most robust of health care systems. There is also a big real risk of these rights being violated. The sexual reproductive health rights, they're being violated, which leads to a shadow pandemic of the gender-based violence. And as this is increasing, there is also the increase of child marriages. Also, obviously, this is going to increase the teenage pregnancies, which are obviously not needed. So on my side, I think this has been the biggest effect of COVID-19, the sexual reproductive health. Thank you.
Thank you very much, Cynthia. Yes, you have mentioned teenage pregnancy, and it's true. We have seen a really great spike, especially in our country, about the rape cases, teenage pregnancies, gender-based violences, and it has been, a saga, a whole thing in our country. So I would love to hear from Christian as well. What do you think has been the specific impacts of COVID on the lives of adolescents, and put also a special focus on sexual reproductive health, and maybe, throw in some other examples. Thank you.
Okay, thank you very much. COVID-19 has actually had a big and really big impact to SRHR services. I could maybe actually let's start maybe look at it in the big picture, the whole world. Like the first thing that COVID-19 thing that wasn't actually usual was a lockdown. So that means every person, whenever you're on this whole world, you're still the lockdown. So the whole lockdown, nobody was allowed actually, which was actually one of the measures they put there in terms of trying to make sure that things that people are in lockdown and have more positives due to COVID-19. So the lockdown specifically itself has actually caused a lot of problems because people were not even allowed to actually go through hospitals as usual. So specifically when we're talking about the youth, especially teens, because they were actually in home lockdown, even if they want to go to medicine issues regarding to SRHR services, it wasn't easy for them. There's no way a kid could have told the parents that I'm going out maybe to hospital or to pharmacy to look for pills because the parents consent to actually come in straight away. So you find that for the kids, for the youth, some of the medicines they need, it was very, very hard for them. So that was one of the things that comes out due to the lockdown. And then again, also because a lot of things will actually shut down, including transportations, including everything. So because of the lockdown and kids were at home, they were living with uncles, they were living with even strangers, because some strangers actually COVID happens while they were actually in other people's home. So it was forced for them to stay there for a while. So you find that you're actually having a person at home in COVID and you don't know their manners and what they could do. And you find at the end of the day, they're actually starting to rape the kids of the host family. You find the rape is actually trying to increase due to the people that are actually at home in lockdown. And also you find because people are not allowed to think, it's very and very hard for them to get some of the medicines they could like maybe pills and everything. And also before the COVID, people used to order the pills like home delivery. If you need a pill, you order the pill or any medical issues. But when COVID comes in straight away, transportation was also a big problem. So that means also the access to get the pills and everything becomes very and very hard for them. And you find the people that are not actually receiving their medicines on time, and you find that not a pregnancy has actually increased, and they find that also the rape cases has increased, and that was really like maybe here, but I believe this is something worldwide that's become like some of the negative impact that COVID has caused due to SRHR services. The delivery was a problem, and the people get actually pregnant, so which increased the pregnancy. That's all. Thank you very
All right.
much.
Thank you very much. Yes, I understand what you say, because we have realized that schools played a protective role for teenagers, because teenagers were protected by the school and services were provided through schools, but that could no longer be done because of COVID-19. And not only that, we also had a problem because adolescents could not walk to hospitals because first they were in their homes. Some cannot really ask for those services when they're in their homes. And again, the movement was restricted. So it was a tricky situation. So I understand that it was a very difficult situation for adolescents, and numbers have proven it. So my question right now would be, I understand that you and Cynthia as well are youth advocates and have been working with an NGO. So I would love to know what your NGO did in this pandemic to support adolescents.
Okay, thank you very much. Before I answer this question, I want to bring up something that most of the people question. We've seen that in developing, they always say that in developed countries, the adolescents are more sexually active, even more than the adolescents in developing countries. But yet, those in developed countries get, less cases of teenage pregnancy. And the thing is, it's because they have enough information before they take a decision to actually have sex. They have the correct information before they take this decision. Like, what are my options? Do I use this kind of contraceptions not get pregnant? How do I go around this? Now, the problem of, adolescents in Rwanda getting more pregnant than in other countries is because of information. So this is what HCI has been doing even throughout the COVID, because they've been giving talks on social media platforms, even on radios, to avail it to all the people around the country, or the young adolescents and young adults, to help them make the right decisions if they've decided to be sexually active, to know what options do I have to avoid having a pregnancy at a young age, to avoid having a kid I can't raise at this age. So availing information in all the possible ways is what HTI has been doing throughout this COVID-19. Thank you.
Thank you, Cynthia. I understand what you have been doing, availing information. So then my question is, how about services? If we have information and if we need those services, how do we go about it? And are the civil societies providing those services outside of the hospitals? Maybe the civil societies have changed the strategy. They're not going to health facilities, maybe they're going into communities down deeper. So you have provided information, but what about services? And that question goes to Christian. So the services, what do you have to say about it? If you have the information, so how do you access the services in this period of pandemic?
Okay, and before answering to that, we'll actually tap on what you actually asked first. And I should say people didn't actually in the first place have information. And before actually the pandemic starts on, we actually, every champion in HDI, we actually go out to different schools. We actually talk on like 20 schools in Kigali. And the whole motive of going to schools was all about to tell them actually anything about the SRHR services, and then actually give them some information. When you have this, what could you do with this and this and this? And then again, what we did actually within information, after the HDI Rwanda have a hotline that is always on, so that we try to make sure that people are calling through the hotline, asking different questions, and they'll be able to answer them. Again, also because when you talk about the youth, there's what we all know, which is the charity. It's very, very hard for people to come and talk about matters of SRHR services like in the whole group. But what we have been trying to do as HDI in the adolescents in HDI, we were able actually to have different meetings through Zoom, whereby we actually bring like different, like a Zoom of like 100 girls and 100 girls taking to them different things about HRS services. Maybe let's start with information how to actually count their menstruation cycles, and when you have this any kind of problem, where could you go through and everything. So the Zoom has actually been able to help a lot because we give out a lot of information to more people, and it also talks about we were able to spread the information through music. Like we have some of the song that has been made with the major stars that we have in Rwanda, sing about this kind of things, so that people will be know that there is not a good thing to be done. And again, back to the question that you asked, that in school now they have services, so information, but how about the services now then? So HDI Rwanda has tried to do its level best in terms of delivering the services, whereby like maybe let's take an example with the morning after pills, the pills that you take after maybe having sex, so that you want to make sure that I won't, you count the periods. You can take it before 3 days when you have done the sex. So what the actually pills helps out, it's actually to help you don't actually get pregnant. So the whole so make sure that you make. Then with the services, that's what I was about. So actually the 10,000 or maybe even above 10,000, but SDI has to make it a little bit on a few amount of money, whereby they're giving it actually on 5. Can anyone hear me? Are we good now?
Yes, we can hear you now, Christian.
Okay, I think.
All right. Yes.
I think it was a connection issues, right? Let me.
Yes, it was.
What I was saying. So,
All right.
So I was saying actually, HDA is trying to give the pill on less amount of money. Pharmacy and other places they cost to 10,000 Rwanda francs. And when it comes to HDA, they actually try. It's as if they sell it actually to 5,000, which is actually they have money other people sell this to. So that means we are giving out the service, we are giving out the information, but also when it comes to services, you have people at HDI, you have doctors. If we have any problems, you come and talk to them, and if it actually needs more measures, they can help out. Also, when it comes to problem, HDI with the service again, HDI has been able to try to advocate for people that actually got pregnant, maybe like got pregnant and maybe it was a rape case, or maybe it was a relative, maybe the pregnant you have, it could actually cost you your life in terms of giving birth to the kids. So also HDI has been able to do different advocacy, whereby they actually been able to release the ministerial order, whereby abortion can actually happen in a safe way. Because back in the days, people used to do abortion like pregnant, and they can't tell their parents anything. And if one at the end of the day, actually consulting a colleague, and that they do things maybe in a world, and they find at the end of the day it's not safe, they are dying or anything else, but it's for them, whereby now 5 reasons that a government has actually been able to accept, such as maybe it was your relative, it was a rape, it can actually be able to help you to do abortion in a safe way. It means that those kids that had actually been pregnant in COVID-19, maybe by their uncles, maybe by any relative or any person with the rape. So that means they were also been able to help to go to the hospital with the advocates of HDI and been able to help them with a safe abortion. Thank you very much.
Thank you very much, Christian. That is really interesting. And I think, yeah, your organization is doing something great about the whole access of information and access of services and affordability of product. It's a whole thing, and we are really grateful and thankful. So as the conference says, is men engaged. So my question also goes to you again, which is, what do you think should be the engagement of men? Like, how far should the engagement of men go when it comes to providing sexual reproductive health services? Because if we have teen pregnancies that are unlawful, probably because there has been a number of men that have raped or the girls, the teenagers, or probably got them pregnant. So I want to to hear about the role you think men should be playing in the sexual reproductive health, in the reduction of rape cases in Rwanda, and in the access and affordability of services. What specifically, what role should men be playing in this whole situation? Thank you.
Okay, thank you very much. It's a true, as you all know, like a girl cannot be pregnant without actually a man get involved. So that means if you're trying to look the issue of pregnancy, the issue of rapes, and SRH services actually in generally, and I will try to look on one side, that won't be fair. So I will actually basically talk about youth, because that's what you mostly deal with in HDI, because you're the champion for the youth. So basically what happens is that, as I said before, through COVID, you've been able to have different Zoom meetings, and due to the confidentiality and to make people feel like a little bit relaxed and be able to speak, we actually had different, like if it's actually a male, we have one for male and another. Basically, we took like almost like 100 people online, and it was all about telling them anything we got regarding the SRHR services. Like also imagine having like 100 boys on Zoom, where everyone is able to actually mute their voice and also mute their camera. That means they're going to speak like truly what they believe and what they actually have inside. So basically, we're surprised with what they say, their mentality and how they actually really think. But we're also being able to transfer these big messages, which was all about having actually girls as your sisters, and not actually looking them in another perspective ways like what you could do with them, but actually have them as your friend, as your sisters, and try to build this environment where are safe actually beside any boys. So, and then what we think the men engaged should actually be actually doing in preventions of this unwanted pregnancy, rapes, and everything. We believe every man supposed to be taught the informations that they're supposed to know about this issue of rape and everything, because some of the days people can see it in one side, like, but the information we actually give them out was all about, although maybe a girl's going to be pregnant, they're also going maybe to do some of their things, but it is destroying someone else's future. We tell them the negative perceptions. That's what all the message was all about. And then again, that was on one side of pregnancies and rape and everything. But we also need a men engage in terms of we need a men engage in terms of SRS services delivery, because we believe if we have maybe a pharmacist who is a man and is actually selling medicines and everything, and you come out to get maybe some of the services there, if the man is actually not that open, because maybe I don't know, because you're talking actually things, maybe different people are actually online. I don't know maybe what happens in your country, but in our country you find that some of the people are not even open actually, even if they're pharmacists. You find for them to give you any services that you need, it's a kind of a little bit too hard for them. Like you need a condom, they may actually say like, what are you going to use it for? Yet it's in pharmacy and you want it for your own self reasons. So basically to bring all the men engaged, we believe that not only young boys, not only young men, not only in terms of rape, not only in terms of pregnancies, but also in terms of SRHR service delivery, every man is supposed to be engaged. And that the only way we believe that they should be engaged, definitely give them the information, like, and also change their mentality of how they see girls. If you see maybe a girl, despite however she's wearing in the street or anywhere, it doesn't give you the fact to believe that you can rape her, or maybe it doesn't give you an she attracts me and I did what I did. But actually, whenever you see a girl around, moving around, look at her as if she's a future girl that you give birth to. If your sister, look at her as your sister. If your father, look at her as your daughter. If you actually a man, look at her as anyone else that you can do harm to. And we believe if you be able to change that kind of mentality to people in terms of rape, in terms of pregnancy, and then if you be able to change the mentality in terms of SRS services delivery, we believe men can be engaged. And we believe what Asia has been able to do is actually to leave this side away of men engagement. Because you find like a lot of NGOs are dealing with girls, like girls do this, girls at least if it happens, country days, girls, there is actually a lot of methods that can help you so that you won't get pregnant. Like it was mostly for girls. And you find beside of the boys that load girls as if they needed people to be with, they needed girlfriends, they needed people that they could do anything with. But then actually is trying to move also forward with the boys, with the men engaged. And we believe also if other NGOs are doing the same, we're going to have a beautiful men and handsome guys that have the mentality that is really, really good and straightforward. The little girls as a friends, as a sister to them, as their mothers. Thank you very much.
Thank you very much. And so I would love to ask. So we have a question in the box, but we shall come back to it a little bit later. And so my question is, some countries and probably ours, we no longer have so many cases as before. So we might probably say that the COVID-19 pandemic going slower. So I wanted to hear from you, the youth, Cynthia and Christian. What do you think should be on the recovery plan of the back on track? I mean, we have been affected in different ways, economically, in the education, sexual reproductive health. So I want to understand from you, what do you think NGOs and CSOs and youth-led organizations should be investing in right now in the recovery plan so we can go at the pace we were at before the pandemic happened? Thank you very much. Over to you, Cynthia.
Thank you very much. Thank you. So I think the civil societies and NGOs should invest more in youth-friendly services, as Christian was talking about it. Like going to a health center and you're probably just 16 or 17 and you're asking, for contraceptive pills, for actually condoms has been an easier thing to ask for, but all the other things, like they make it really hard to ask for it. Because you're a kid, they start asking questions you're not ready to answer to, or you feel uncomfortable to give answers to. So I think investing more in creating youth-friendly services in certain areas that they are not currently having these youth-friendly services would be a great improvement. Also working on cutting the financial barriers, as HDI has been doing it, cutting the price of some contraception pills, considering how other pharmacies are selling it on. So it's important that in every single place, because if HDI is working in Kigali, what about the people who are outside of Kigali? Where are they going to get the exact amount of money to buy, probably to afford these services if they are on a high price and they can't afford it, which is obviously always going to be a barrier. Also, information is never going to end. Improving the availability of correct information every time to the target population. This should be something they should really improve. And lastly, I would like to talk about familiarizing the discussion about sexuality, because the more sexuality becomes a taboo to talk about, it creates more discrimination to the people who are going to look for the services concerning sexual reproductive health services. So increasing the familiarity around the discussion of this topic, in meetings, in schools, parents to children, these NGOs and civil society organizations should be the ones that put an initiative and improve how these discussions are worked on, because it's a very important issue. Thank you.
We can't hear you. You're on mute.
Sorry. So, Cynthia, I understand what you've been saying. So we need to decentralize the services and go from Kigali to rural places so people can actually also afford the products. And you also need to put much efforts in information, in the way provide information so that they can reach to other people. And lastly is to decriminalize or destigmatize the talk around sexuality. Thank you very much, Cynthia. And Christian, what do you think we should be doing in this pandemic? like in this post-COVID, post-pandemic period, so that the youth can get back on track and everything. Over to you, Christian.
Okay, okay. I don't know maybe how is it with the rest that actually on online, because a lot of people are there. I could actually say maybe particularly in Rwanda. First of all, we are really thankful for the matter of fact that students will actually, because now they're occupied with school. It's not like before in COVID, because they were at home doing nothing, so they have a lot of time to do things that you can't think they could be doing. But so far, right now they're actually back to school, which is a good thing because they're occupied. But it doesn't mean we're also going to let it stop. And we are looking forward by the time maybe government will actually allow people to be together again, like gathering with the people, so they could be able to spread back again the information to them. Because but now it's really hard to get people around together with any message that you want to give them, especially for schools because of the means of preventions. They don't allow people to come in, but that actually can't give us a thing to say no, we're done, and not going to continue to do our level best to advocate for SRHR services. So what basically could we do? I'm talking about actually here like HDI and any other NGOs, like even any other person individually. We believe social media is still there, and the social media are really good tools to transfer good messages. So people, whatever they are, like even HDI is continuing, although kids are back to school, it doesn't mean that HDI is going to stop all the radio talks that we normally have. No. But we are going to keep emphasizing on that. So we believe we are going to keep on giving the informations. But we add only the informations. Now the kids are there, they're at school. It's really good because now if they have a problem, they can actually now go to pharmacy, they could actually now call and come to HDI, we have them out. So that means whatever we've been doing before, we are going even to do it even more further, because that means there was a black way kids were at home. We didn't have that much access to them, to talk to them, not only kids, even youth. So for now, they're actually again at school. That means going to be easy for us to actually put in even more effort, because we believe whatever they learned back in the days and they've been for 7 months at home doing nothing, we don't believe the message is still right there. So that means the message is still more emphasizing and more pushing forward. So basically what you're about to do is actually keep on doing what you've been doing, but with more emphasis. Make sure that all the 7 months, whatever happens, you won't discourage them to keep up with what they've learned and to keep up being the best person in society that we want them to be. Thank you very much.
Thank you very much. So let's go back to the question in the chat box. It says, are there any positive outcomes, obviously, that have come out of COVID pandemic for you? Like, did you learn anything that will be useful in the future during this period of pandemic? Cynthia, over to you.
Okay. If I learned anything concerning the social reproductive health rights, I guess, apart from all the information I already had, actually, the thing I learned about is the role of men. It's like an idea, actually. The role of men, like having fathers home all the time, not like, before the lockdown, fathers would mostly, not mine obviously, but other parents would mostly be in bars or, in elsewhere, just not home most of the times. And having them home emphasize on their role as parents. It puts them again in the responsibility of monitoring the activities of their children every single day, which shouldn't be given up on just because the lockdown is over. Because monitoring their activities lets you know more about how are their lives, what are the decisions they make. You should be involved in those decisions, and I think this would really be a good thing going forward with helping these adolescents make more best decisions rather than getting even more teenage pregnancies in the future.
Thank you. Christian?
Thank you very much. I believe the question is all about if there is anything positive we have learned through the pandemic, but regarding SRHR services, right?
Yeah, that will help you for the future.
Okay, that will help us for the future. Okay.
Yes.
So basically, what we learned as a champion in HDI, let me talk in that way, is that actually the more youth are out there doing nothing, that's the time they start actually doing some of the things that There are some of the things that maybe that like sexuality and everything else. So we found that if the people are together doing nothing, that's when they do some of the things that are not really good. So what have that showed us and what have that teach us as a champions? It has actually shown us the picture that whenever people are actually there doing nothing, that's when we have to do more advocacy. Because when the numbers start to increase in a pandemic, we actually saw that we need more and more things to be done, which is when they actually come up with the radio. That's when they actually come up with the Zoom, because you actually be like, let's have some of the things that will put people together and make them actually talk about the things in line. If the kids thought that having sex is the best thing ever, then he's actually in lockdown. That's what he's going to talk about. But we actually took that time as a way to actually tell them the information, like what you have been thinking. That's not the good thing to think about, but this is the right way and everything. So, and also another positive thing that COVID has given us, that some of the people who believe that I can't, okay, like let's talk about the youth believes like I can't live with a girlfriend with a boyfriend. Like they believe that was the only way of life to go, you know. But with this 7 months that actually happened, it actually showed them that things are really different. In what ways? In a way that if they saw that the whole 7 months are done and they've been home alone, while they actually used to have girls as if it's their safe place to go and everything, they have actually misused them and give them other titles like girlfriend as if it's a secure place for them. And the COVID has shown them they can even live long without them. That gives us a good message to spread about the men engaged. Like have them as your sisters, not as a person you can go and run through. And that has also showed them, because as a fact they have seen that if I've been actually this whole 7 months actually being okay, and then I've been actually having different minds about something. So it's also give them actually a thing to learn about and be like, I could have girls as my friend, but I could not have them and lie to them that I love them, play with their hearts, yet I'm not. So that also give them these good things of men engaged and be able to have girls as a friends rather than anything else. And I think that's all. Thank you very much.
Okay, thank you very much. So I understand that the pandemic has put a light on how important it is to have parents at home. So it is not a duty that they should just have and put away because the kids are back at school, but it is something they should continue doing, helping kids and talking to them and be there for their children as they were in this pandemic. And I guess the pandemic also has put a light on the gaps we had in sexual reproductive health, the things we should have done before the pandemic hit, and probably the thing we have to do, how much effort we have to put in some specific places in protecting kids and children and adolescents and youth. And I believe also that we started centering conversations around involving men in the sexual reproductive health processes because they can also play a protective role in addressing the issue and in protecting further the people who are assaulted or harassed or something like that. So we are 3:45. So I still have a question for you guys, and I would like to understand your point of view in about this point. And it's a thing we strongly talk about, and it's a thing that civil societies and NGOs and the government are emphasizing on. So I would love to hear from you on this, your point of view on this. My question is, how do you understand youth involvement? Are you do you have any idea what youth involvement is? And do you think you are involved enough in the processes that are, especially on sexual reproductive health, the laws that are being passed, the activities that are being done? Do you feel involved? And if yes, it's good. Then if you feel not actually involved enough, how would you want to be involved further as youth? Over to you, Cynthia.
Thank you very much. My answer is actually yes, because working along HDI, even before that, I love that every time they're going to make a certain law that involves sexual reproductive health and rights, they bring up debates. Most of the times they bring up debates in schools, in universities, in secondary schools, for kids to talk about it, giving their ideas, giving their point of views that would be taken in account before they actually before they make a certain policy. So I feel like we are very much involved. Also, in addition, that we were taking, we were given trainings by HDI to be able to advocate for other adolescents. We were given those trainings when we were adolescents, and that's another uh, proof that we are actually very much involved in these decisions that are regarding our sexual reproductive health. So I would say until now, yes, we are very much involved. But then I don't feel like it's only HDI that should be taking an initiative to actually involve adolescents and young, and young people to give their point of views and decisions made on their, on their sexual reproductive health. I also think other NGOs, other organizations, society organizations should actually start that, because if HDI can't reach the whole population of adolescents in Rwanda, there should be other backup organizations that should be doing this. Thank you very much.
Thank you very much. I will have to ask Christian to be more specific about men. Do you think men are involved? But I know they are involved, but what specific action should men be taking in curbing teenage pregnancies? And how do we involve men in this discussion? Do you think men are involved enough in this discussion? If not, what do you think we should be doing to involve men and to get their attention in with regards to sexual reproductive health in curbing the teenage pregnancies and child defilement cases in Rwanda? Thank you.
Okay, thank you very much. I could not say that, okay, mains are engaged, but I could not say the mains are engaged enough as it should be. And I could also say that there are some that actually stimulate this. For example, if it's like the mains, if we have all those Zooms I've been talking about, you actually bring the people that will build their youth. So that means mostly like 15 about men actually means every male in general. You find that the way you believe the men could be engaged and in a good way, you believe that every single society actually play a part in this. Make sure that your home and your family is the focal point of the men engaged. Is for the low level with the families and everything. And also it talks about NGOs, HDI has been doing it level-based, and the other NGOs are doing also their level-based, but there are also some of the NGOs that you look that are really lacking behind, right? Find they're helping girls more than men, and if you don't have equality of men and the girls in terms of fighting this, it won't go anywhere. So we believe that also every NGOs, please, they should actually be on the board, bring people together and try to deliver and have things that we could actually bring people about and talk about it and make sure that people are going to have the positive minds and attitudes about it. So again, when it comes to also the government is also supposed to do like something that also be like, you can see the government is doing something about men engaged. Why am I saying so? For example, we see the government is actually bringing and actually maybe bring in a lot of boards on the way talking about maybe COVID, talking about malaria, talking about diabetes, talking about different sickness that actually can affect people. But you also need, because those people that we talk, the men you're talking about, almost like 37, 39, to get them, put them somewhere and teach them about the men engagement is going to be very, very hard, right? But we believe they walk, they pass every day, they watch news, they watch different adverts. So we need also the government to actually put the billboards there, talk about men engaged. Or that could actually be a small message. See every girl as your sister. Simple as that. If a person reads that kind of a message, it will actually stay in their heads for a while. And that may help them through some of the good things. So we also need to see that working level based. Government, as I said before, it has also actually been for the well brand to girls like they're getting pregnant. So every time solution has actually been looking for on the side of the girls. They're like girls, so because you know that you do sex, so for the sake of you not getting pregnant, they give them some of the solution. Please control your days, take some of the family planning methods. But you find the men, nothing has been spoken about it. It's as if it's only girls who actually contribute a lot to that, which is so as government actually put billboards to girls telling them use this and this, you also need the government telling males and do its level best. Be like, do this and do this and do this. I believe from then we can engage a lot of men as possible. And then NGOs do their part, and also family do also their part. By then we could have a good society of men engaged. Thank you very much.
If you don't mind me adding something on, the men engagement concept, I'd like to talk about, we always say gender equality in homes. We always say there shouldn't be activities that belong to women and activities that belong to men specifically. And that has been, it's been in process. People have been trying to respect it. But I still have a question on why talking, having a conversation with your daughter at home about their sexuality, why is it still a job for women? If we really want full men engagement, we need fathers to, to contribute. We need fathers to be, to be okay with having this kind of conversation with their daughters, to feel free around them talking about this. I'll give an example. There's sometimes, like in rural areas, you actually see a mother is probably talking to her daughter about something. She probably got pregnant, and then they agree on a decision that they are, she's going to have an abortion. And then all of a sudden, the father comes out and he's like, "No, this is not happening." He is actually going to sabotage all this plan because he's never been included in these kinds of discussions. If you really have fathers' engagements, to put in the full men engagement, having fathers is the first step. It's going to actually reduce the problems we're having with teenage pregnancies increasing every day. Thank you very much.
Thank you very much, Cynthia. That is. It's
like,
all right. Thank you. Keep them coming.
Okay, I was actually going to say nothing could be that good. By the time that you find that a male is actually on the table telling their daughter this is how things goes and this is how things goes. So basically that, like, as you all know, goes on. So by the time that you see a dad is doing that kind of thing, maybe for example, it's my dad, and he's telling actually my sister this how can't your master cycle and everything. Imagine what my dad been doing. So if you also need this kind of men engaged things to happen, so we need to family, we do it, NGOs do it, and also government also contribute. That will actually give us this better set that we're all looking for. Thank you.
Thank you very much for your insightful ideas and discussion. It has been really interesting to listen to you talking and closing the discussion. I would love to give a small resume summary of what we talked about, and so that we can close with the same understanding. So we started on the impact we have seen about on sexual reproductive health and rights during the pandemic. You have all mentioned the rape cases, the deferment cases, the pregnancies that have spiked a lot in the pandemic, the services we have provided, the information we have provided, and how we managed to keep in touch with the population during the pandemic, because that was really crucial. People could not move, children were at home, services they used to access at school and information were not being provided, and that was a problem. And so that is what I've been doing as an organization. And as an organization as well, I think, what else have we talked about? We have talked about how to engage men in this type of discussions. We have talked about how to go further as an organization, as a person, as a family, where family could put in strength. And we also talked about what CSOs and NGOs should be doing to help the society curb the teenage pregnancies, and also to engage men in curbing these pregnancies. I think this was a whole discussion, and do not stop the discussion here. And one thing I would love to say specifically on the engagement of men today, as we talked about men engage, Ubuntu, I am because you are. We need to remember that the value of a woman, the value of a lady, the value of a girl does not limits itself on her being your sister or your mother or your aunt. We should probably be telling men to respect and to respect and to treat girls and women as human beings. I think when we start there and understand the Ubuntu concept, then this whole thing will go further. And I would love to thank the NGO that you have represented, HDI, for the work they are doing. It's really a commendable work. They have been doing amazing things. This whole pandemic, we have seen it, and we are really grateful. And I want to thank the Men Engage Ubuntu Symposium for this initiative. It's really important that we shift these discussions from men only to engage men in this whole thing, so they can understand their specific roles in helping and protecting the rights of women. Thank you very much. I think I'm going to end the discussion here today, since we have no other questions. And I want to thank Syniad for hosting us. And over to you, Syniad. Thank you very much, Cynthia. Thank you very much, Christian. I hope we take this discussion further and tell people what we should be doing to protect adolescents. Thank you very much. Syniad, over to you.
Thanks to all the panelists. That was such a great discussion. Nothing else really from my end, just a reminder to keep an eye on the app and keep attending the symposium sessions. They'll be happening every Tuesday, Wednesday and Thursday between now and June. So really hope to see some of you there. Yeah, thanks everyone. Have a great rest of your day.